morning. Welcome to another episode in Build Healthy Places Network's video snapshot series. Build Healthy Places is a national nonprofit working at the intersection of public health, healthcare, and community development sector to drive upstream community investments to more effectively reduce poverty, advance racial equity, and improve health in neighborhoods by addressing the root causes of health inequities. We're excited in this current video series to speak with organizations who are expanding how we think about community engagement, community voice, and power. So it's exciting today to hear from the Association of American Medical Colleges Center for Health Justice. We're joined by their founding executive director for the center, Philip Alberti. So welcome, Philip.
Hi, Ruth. Thank you so much for the opportunity to chat. Looking forward.
Yeah, it's great to have you. So earlier this year, the Center for Health Justice released the Principles for Trustworthiness and an associated toolkit and materials. So can you begin by sharing a little bit about how the principles came about?
Sure. So our team, the center has just celebrated its 1-year anniversary, but before the center launched, our team had put together what we called community engagement toolkits for about 4 or 5 years for our annual meeting. And they focused on various issues that were most important to communities wherever our meeting was going to be. So we focused on carceral health and refugee health and other aspects of health. And our plan for 2020 had been to do veterans health. We were going to be in DC. And then, of course, the pandemic exploded. And our team was watching the news along with everybody else. And we heard a lot of experts, medical experts, public health experts, scientific experts talking about communities and trust and thinking about vaccines and clinical trials. But we didn't hear a lot of community voices in that conversation. We heard a lot of experts speaking on behalf of community. And when they spoke, they were speaking, almost as if the job was in the community to get over their mistrust or distrust, right? As if, they could just, if the community only knew better, if we could just come up with a magical pamphlet that was in the right language, with the right jargon, with the right photographs, we could just kind of disseminate to all the communities that we work with, and the distrust and mistrust would just disappear. We in the center thought that was patronizing and maybe a little wrong-headed, and really wanted to take the opportunity to lift up and center community voice in this conversation about not what it takes for a community to get over mistrust, but really put the onus where it belongs, right? What does it mean for an organization with power and privilege, like a public health department or a hospital, to actually demonstrate that it's worthy of their community's trust? And so to develop this toolkit in the time of COVID, we worked with our Collaborative for Health Equity. It's a group called AAMC Charge, about 1,300 or so health equity champions from across the country. Now, we asked if any of them had qualitative expertise, interview expertise, videographer expertise, and we worked with 9 folks from 7 different places across the country, who then each in turn went and interviewed between 3 and 5 local community residents, virtually, of course, and paid those community residents to really understand what that would mean for any kind of organization to demonstrate that trustworthiness. And then that full group of us, the center folks, those charge collaborators, and those 30 community members, all of us together went through 20 hours or so of video footage, extracted the principles, did that thematically, developed the toolkit, and that's the origin of the toolkit. It really does lift up very clearly community voice and perspective on what it means to show that you are worthy of trust.
That's wonderful. I love that framing. So the process of engagement is as important as the product. So these are the words that introduce the principles and could be a tagline for this snapshot series. Definitely something that resonated with us at the network. So you're emphasizing that the process is as important as the product or the end result. And so can you tell us a little more about what difference that makes to a community engagement effort?
Oh my goodness, yes. It's kind of this, it's the secret sauce. It's all of it. It's everything. Community engagement, that's one maxim that we say, right? The process is as important as the product. Another one that we always say to each other and ourselves, that community engagement, it isn't a thing you do on the weekends. It isn't that thing you do once a week after work, right? It's the thing it's how you do all the things, right? And it's baked into every aspect of an organization when it's done right. And it's iterative and it's long-term, and it's initiated not with an outcome in mind, but literally just the breaking of bread, the building of relationships, right? The demonstration of trustworthiness. And so I think that that is truly what's captured both in those principles around authenticity, bi-directional communication, power sharing, right? The way in which you build relationships, the openness, the humility that you approach that process actually yields better outcomes regardless of what that outcome is. And I have to say that's also something that we hold ourselves accountable for internally as well. So I mentioned the center is just a year old. And so we had a chance to build our own processes and really begin to try to understand how the way in which we work together and the respect that we have for each other, the autonomy we give each other, the support, how that in itself actually yields better outcomes and products, even for an internal process. So we do our best to try to really flatten the hierarchy. You know, if there are project managers that need, you know, a skill that I have, even though I'm the director of the center, I'll report to that project manager on that task. This is really about everyone kind of developing professionally, functioning at the top of their game, contributing maximally, and really feeling kind of ownership and pride in the contributions to the process and eventually the output and the outcome of that output. And so I think for community engagement, understanding that it's not a singular thing. Oh no, there's a crisis. Now we must community engage. Right. Like the exact opposite way to do it, right? We are always engaging and learning and partnering so that when there is a crisis, we have that substrate, we have that foundation of trustworthiness. So action and being nimble with those actions are possible.
Wonderful, yeah. So as you described, this was born out of the sort of COVID crisis moment. And so people might hear about an association that's got medical colleges, Center for Health Justice, and assume these principles are focused solely on clinical interactions. But certainly our work at BHPN points to health justice being a wider concept that incorporates drivers from health from other sectors. So I was curious, how do you think these principles might apply or translate to other sectors, say, for example, community development organization or public health organization in their work with communities?
So I think that's an important point and an important question. So you'll notice in the toolkit, whether it's the action guide, it's something I didn't say earlier, right? It's not just about these 10 provocative principles. It's also about co-developing the actions that demonstrate locally that you understand the principles and that you're walking the talk on those principles. So it really is an action-focused kind of undertaking. But nowhere in the entire toolkit do the words medicine appear, or healthcare, or doctor, or clinical care, or physician. It really is meant to be kind of sector agnostic. Because as you said, Ruth, the health ecosystem, yes, it's inclusive of healthcare and medical care, but it's so much more. Every single sector of society contributes to population and community health. Public health, education, transportation, housing, civil rights, medicine, and they're all crucial. And all of our best social science tells us pretty clearly that when it comes to community health, medicine or medical care is about 15 or 20% of what makes an individual or a community healthy, right? So if we're just focusing on the clinical piece, we're missing the majority of what makes us all healthy and thrive. And I think to hammer that home, one of the things that our center does is we do public opinion polling. It's one of our ways to try to get at community voice and perspective. It's not exactly the same thing as maybe that deeper engagement in developing the toolkit, but it gives us a snapshot about where different slices of adults in the US are. And our first public opinion polling was on the trustworthiness of different sectors in society. So we polled adults over the age of 18. I think we used 15 or 16 or 17 different sectors. So public health, local businesses, pharmacy, medicine, et cetera. And we asked them how much they believed that those sectors treated everyone in their local communities fairly. And so some surprises for me about the relevance of this work across sectors. So the most trusted sector across every socio-demographic, racial, ethnic, gender, age, generation group, by far, were fire departments. Wow. So, right? Before joining the AAMC, I worked for the City Health Department in New York, kind of much more on the ground, shoe leather, epi and community engagement. We almost never partnered. I can't even recall a time when we partnered with fire departments. So what is that? We have a lot to learn about the trustworthiness of fire departments. But I will tell you this, we always partnered with two of the sectors that were rated the least trustworthy. So still more than 50%, but the least trustworthy were universities. They were always our first go-to, and faith-based organizations. They were always our second go-to. And again, it looks different depending on which populations you analyze and kind of what strata you go to. But I think it speaks to the importance of the nuance of trustworthiness and the diversity of our communities, and how not every sector is seen as automatically trustworthy by everybody in a neighborhood or everybody in a zip code or everybody in a town. It's really imperative that we understand that we do that shoe leather work of breaking bread and building relationships, so that we understand, oh, well, for this issue in this community, we're going to work closely with libraries and local businesses, and maybe on this other issue, faith-based organizations and police departments make the most sense. It's not a monolithic thing, right? Just like our communities are diverse, the ways in which we engage with our multi-sector partners also has to reflect that diversity of thought and experience as well.
Yeah, makes sense. Yeah, great insight into perception from the other side of your own institution. That's amazing. So can you give us an example of how a multi-sector effort can lay the groundwork for what you describe as the long-term relationships, shared resources, and collaborative decision-making that's needed?
Sure. I'm going to dip back to my New York City Department of Health days, where we kind of lived and breathed by these kind of cross-sector collaborations. So part of my work in New York City focused on food and fitness. And so the first step in a partnership I remember was thinking about how we got local bodegas, so local small businesses, kind of corner stores, to sell more fresh fruits and vegetables. So that was an initial coalition of community members, local farmers, small business owners, these bodega owners, as well as the distribution businesses that were actually kind of bringing produce to and from different locations. And so that was a pretty successful pilot. And then he wanted to really think about other ways to create kind of food security in the communities where we were working. And so we worked with those farmers again. We'd already built up some trust and trustworthiness in that first partnership, to really think about farmers markets, how we could incentivize the purchase of fresh fruits and vegetables using EBT, and maybe even giving, like, for every dollar you spend in food stamps, you get $2 or $3 back in fresh produce. We wanted to work with the healthcare systems to host farmers markets on their parking lots. We wanted to work with parks and recreation to do that work in public parks. So now we have healthcare, the farmers, the distributors. We had to work with agriculture and markets at the state level because of the EBT perspective. And we did cooking demonstrations. So we bring in nutritionists. And we also did these cooking demonstrations in public schools and nurseries and daycares, and our bring in Department of Education. That was also really successful. And it not only, built on the relationships with the farmers and the community members from that first work with bodegas to make this kind of farmers market work take off in a faster way than it would have otherwise. But by bringing in Department of Education, when we later wanted a partner to pilot comprehensive sex education in middle schools and high schools in the South Bronx, we had already built these kinds of relationships with our sister agency in the Department of Education that facilitated that other work that wasn't even food and fitness related, but that required those same kinds of partners. So it really is a multiplicative kind of snowball effect, right? If you can demonstrate that you're trustworthy and that you're approaching the partnership with as much respect for the input and advice and insight as others as you hope to get for your own, it really just carries forward and makes all the subsequent partnerships more possible.
Yeah, I love that. Well, thank you so much for sharing your time with us today, Philip. To borrow from principle number 10, the project may be over, but the work is not. BHPN will definitely continue to follow the Centre for Health Justice's important work and share with our network. And you can read more about the Principles of Trustworthiness and the Centre for Health Justice's work on the links we provide on this page. So it just remains for me to thank everyone for listening today. Thank you.
Thank you.